Although Bell's palsy is a condition which gets corrected or else improved in time or its duration of 3 months, there are few people who will experience delayed recovery or else say incomplete recovery from Bell's palsy, and there would be some group of people who would have recurrent episodes of Bell's palsy. Now, why does it happen and what are the conditions that makes this to happen? We are going to discuss about it in today's video. So make sure you stay tuned till the end. Hello friends, I am physiotherapist Meghna Dave and welcome to HealthQ channel, the health awareness channel where our mission is to motivate you to look at the brighter side of the health. In today's video, as mentioned, we are going to talk about causes of recurrence of Bell's palsy and delayed recovery or else incomplete recovery of Bell's palsy. Now, there are few conditions that can lead to the symptoms or else say delayed recovery or recurrence. What are these conditions? Although being rare, are something that requires precise medical diagnosis and more precise medical examination. So, if you who are someone who is experiencing a recurrent Bell's palsy or else say persistent Bell's palsy which is not getting cured completely, I would highly recommend that you listen to this video and make sure you take further medical advice from a neurologist, ENT surgeon or else your physiotherapist. Now coming to first to the causes why there is then chances of recurrence of Bell's palsy. Now mostly if you look at the researches, there is no particular known cause for recurrence of Bell's palsy, but there are few conditions you are having, you are more prone to develop recurrent Bell's palsy episodes. Now what are these conditions? The first condition that make you at higher risk of development of Bell's palsy over and over again is diabetes mellitus. The people with diabetes mellitus and Bell's palsy have got higher chances of having a second or third episodes of Bell's palsy as well. Even if you experience Bell's palsy while being pregnant, you are having the chance more of getting another episode of Bell's palsy. Again, I'm telling you, the chances persist. This is not sure that you will definitely have Bell's palsy. Please don't take it in that way that if you got Bell's palsy while pregnancy, definitely you will have another episode. You have a little more higher prevalence of developing a second episode of Bell's palsy. The third condition that put you at a risk of recurrence is malignant tumor or else and non-malignant tumor being present in ear or else in the brain region. Especially a tumor called as schwannoma leads to more chances of development of Bell's palsy. Sometimes if Bell's palsy is something that is running in families or else is present in hereditary, you might have the more chance of development of Bell's palsy again. Sometimes some genetic disorders where there is some abnormal chromosomal mutation, you might land up or else you might be more prone of development of Bell's palsy again. Another condition called as fibrous dysplasia of temporal bone also leads to increased chances of Bell's palsy. Now what does this mean? Fibrous dysplasia of temporal bone means in this situation your normal bone of your skull, especially the temporal bone which lies on your ear side, this bone is being replaced by a fibrous tissue which increases the chances of you developing Bell's palsy. If your ear canal, the middle ear canal from where the facial nerve passes, that is narrow since birth or is due to some birth anomaly, that also put you at higher risk of development of Bell's palsy. Again, if you have got poor immunity and you are having if you have got poor immunity, again you might be at a risk of developing multiple infections in your ear canal, leading to more chances of developing recurrent episodes of Bell's palsy. And the last but a very important and a rare condition is called as Michelson-Rosenthal syndrome. Now this condition is a rare disorder where there are three symptoms which are present in combination. The first symptom is recurrent Bell's palsy episode. The second symptom, fissuring of the tongue. That means your tongue will have multiple fissures present. And third, facial swelling. If these three symptoms are present together, then this condition is called as Michelson-Rosenthal syndrome. Although being rare, requires a proper diagnosis and proper clinical examination. So this was about the condition that puts you at higher risk of recurrent episodes of Bell's palsy. Now coming to why there is an incomplete recovery, delayed recovery, or no recovery in Bell's palsy in some patients. Now there are certain conditions in which there is the chance of this incomplete recovery or else no recovery happening from Bell's palsy. It needs to be ruled out and proper clinical examination is required, and different type of treatment is also required. These conditions are Lyme's disease. Now, Lyme's disease is a condition that happens following tick bite. Now, tick bite, ticks contain a certain kind of bacteria which invades into your body and lead to bacterial infection of your ear and creates more major damage to your face, especially the facial nerve, leading to delayed or else incomplete recovery from the Bell's palsy. The second condition that happen that lead to incomplete recovery of Bell's palsy is Ramsay-Hunt syndrome. Again, there are other clinical factors that are responsible and are present in this condition which needs clinical rule out. Many patients have conditions like vasculitis, diabetes mellitus, HIV infection, sarcoidosis, paraproteinemia, Sjögren's syndrome, malignant and non-malignant masses being present in the brain or else in the temporal region. These are some certain medical conditions that puts you at the risk of no recovery from Bell's palsy to partial recovery from Bell's palsy and needs proper investigation. Hence, I would highly recommend all those people who are commenting in the comment section that my Bell's palsy recovered to a certain extent and is now not improving at all. I would highly recommend you to see a neurologist or else an ENT surgeon to figure out what is the condition that exists in you, what are the risk factors that are present in you, and based on that, the treatment protocol can be decided. I would request you all for going for that further investigation. So friends, I hope you found this video informative. If yes, make sure to hit that like button. Don't forget to share this video with your friends and family members, and make sure to subscribe to this channel for more such health informative videos. See you next time. Bye bye.